welcome again to another installment of Mwanangu Mtanami Family Podcast. As always, we're here to bring you more important insights around our favorite subject matter, pregnancy and parenting. This week, we invite you to listen in while we have a discussion with our guest, Charity Marua. She's a mental health specialist who specializes in counseling for families for individuals. We'll be talking specifically around attention deficit hyperactivity disorder. This is ADHD. When I grew up, it was called ADD, but now it's got a different name. So we hope with more information, you have more freedom in making more informed decisions and choices. So we'll begin by welcoming our guests. Hello, Charity, welcome.
Hi, Janet, how are you?
I'm super awesome, and we are so happy to have you here. Thank you for joining us.
And thanks for having me. I'm super excited as well to be here.
Wonderful stuff. So we're just going to get right into it, and we'll begin by getting to know a little bit more about you. So please tell us a little bit more about yourself and what you do.
Okay, so I'm Charity Marua. I am a mental health specialist. I specialize in counseling, and so I do see families and individuals who have various problems, really. And my job as a counselor is just to help them find solutions for the problems that they're facing. And yeah, that's what I do every day.
Wonderful. It sounds exciting. So today, since we're talking about attention deficit hyperactivity disorder, can you please tell us a little bit more about this? It's a condition, right?
Yes, it is.
Okay.
So just as the abbreviation suggests, it's called attention deficit hyperactivity disorder. It used to be called ADD, and that would have stood for attention deficit disorder. You will notice that the hyperactivity is missing in there. So now it's just a combination of everything. And so it's the same thing essentially, but with a different name. You know, things that change as we move.
Yeah.
But otherwise, the symptoms and everything is still the same.
Okay. So what does it look like? How does it present? And I think most importantly, we want to be able to know how one gets it. Is it hereditary? Is it something that happens because of the environment? What is it? What are the particular nuances about this condition?
Okay, so it's caused by multiple factors really, and it is a combination of genetic and environment factors that sort of bring it about. Just the interaction of those two, it is not purely known which one would be higher than the other, but there's a combination of genetic and environmental factors influencing it. And the environmental factors, include things like maternal smoking during pregnancy, and the duration of breastfeeding as well. There are researches that has been done that point to, the fact that the children who are less breastfed or who are not breastfed are more likely to develop ADHD in their adulthood. So yes, that's the constitution of ADHD.
Wow, those are some interesting insights. So if it's not within your gene, then you still are not breastfed. You might not get it, right?
Well, there are slight chances that, it could come. Like I did say, it's hard to tell which factor influences more than the other. But usually, according to, the findings that are there, it's usually a combination of that. You find that in a family where there's been someone who has suffered from ADHD, you're highly likely to find 2 or 3 kids also, having the same condition, and that is definitely coming from the genes.
Okay.
And yeah.
That's very interesting. Yeah. So essentially, when someone is presenting with ADHD, like probably what age do you start to tell that this person has the condition?
Okay, so the symptoms usually present around the age of 7.
Okay.
For most people, 6, 7. This is essentially because this is the age that children start going to preschool, and you
Mm-hmm.
start to see some symptoms, which sort of differentiate them from the others in
Okay.
terms of what they are expected to do and what they are supposed to do.
Okay.
So the symptoms, they vary. There's, short attention span, for their age.
Mm-hmm.
There's difficulty listening to others, difficulty attending to detail. They're
Okay.
easily distracted, and you find that most of them are also forgetful and have poor organizational skills for their age. So you find that in a class of 10, you're
Mm-hmm.
always chasing after this kid who probably does not want to sit down, is always distracting others. And so you'll find that in most cases, the teachers at schools are also maybe those who find out first, if not from home. I find that in my work,
Yeah.
the most of what parents say or come to me with is, this child is naughty, or animsikanzwa.
Mm-hmm.
If it's at home, you will see that they're on top of tables, and they're doing these behaviors that parents just fail to sort of nip in.
Yeah.
And so that's how they then come to me. And
Mm-hmm.
you find that for some people it just goes unnoticed, into their maybe early adolescenthood or even adulthood.
Okay.
And like any condition, if it then goes that far without being noticed, it means we're just at a disadvantage, because there is no interventions that are given before time. So just to answer your question, mostly they present as a social issue rather than anything else, because they think, can you talk to this child? I am failing to get through to them. And you find that a lot of them, the children, would have gone through a lot of beating as well.
Mm.
As in our culture, there's still this norm, spare the rod, spoil the child.
Mm-hmm.
So usually the tendency is to want to get this child to listen to instruction. And so the only way they do it is, that beating, and yeah, that's how it gets to me.
Wow, that's really interesting. So it's as you were talking, you talked about how they end up coming to your practice. At what point do parents then realize that they need to see a specialist? Particularly in our culture, people don't go for counseling, and you are a mental health
Mm-hmm.
specialist who specializes in counseling. So at what point do people say,
Mm-hmm.
okay, enough is enough, I think I need intervention or support for this?
Mm-hmm. So the breaking point really for them is realizing that they need help when they're at home with a child who is exhibiting these behaviors, and they think they're coming for social issues, like maybe talk to this child, I don't know what is happening to them.
Mm-hmm.
This child is a grade 5, and the teacher says, his work is like one of a grade 2. They think there are social issues that are attached to it. And
Okay.
so as soon as they come to me, the flags are all over, especially when you then talk about the history of the child and the tendencies that they are exhibiting. I think that's the most valuable time spent for them, because then I then point them to the right direction in terms of the flags that I would have seen.
Okay. All right. No, that's really, really
Mm-hmm.
interesting. And because you're talking about how then families come to you, I think you dropped
Mm-hmm.
it within your response earlier, but I would probably want us
Mm-hmm.
to zone in on what it is, what kind of an impact ADHD going unchecked has on kids. At that point where a child is just going through their life and they don't know what's going on, what does it mean to them?
Mm-hmm.
And how then can we support them in that space?
Mm-hmm. So it's very difficult, for a child who has this condition, because they are constantly getting reprimanded, and so you'll find that both the child and the parent sometimes are just so angry and frustrated.
Mm.
And that is not a good place to be for both of them. So you find that when they then present to a mental health specialist, they are just both weary and tired. And
Yeah.
so and so it's just important at times for parents to know that if they are noticing these behaviors, they must keep a record, and surely if it's persistent, they need to look outside of their family for help.
Okay. Yeah. So
Mm-hmm.
it sounds pretty deep and steep, and you can imagine
Mm-hmm.
how many issues that these children probably have gone through because no one can actually tell them or diagnose them properly.
Yes. Yes, and entirely. And you find that most of our people in our generation are working people.
Mm-hmm.
And so these children also often find themselves with the helpers at home
Yeah.
who are also, needing to go on with their work and not be chasing after a 7-year-old boy who is, presenting with these behaviors. And so the helper will also try and do what they can, to get things
Yeah.
going. And those things that they can do really vary. It's either they ignore the child, it's either they're also exerting some force or whatever. And so it's really important that, people are just aware of what is going on with their children
Mm-hmm.
and just be watchful at the same time.
Okay. So that brings up another question in my mind. You
Mm-hmm.
talked about environmental factors. I'm wondering if this child has hyperactivity and low concentration, there's certain foods that we probably eat that can also contribute to exacerbated symptoms, right? Because I know sugar will give you a sugar rush. And if this child already is all over the place, is there actually like something that specifically speaks to foods that, probably catalyze whatever progression or the symptoms that kids show?
I think, like you rightfully say, things like hyperactivity, of course, and sugar, would be a bad combination, just like with any child. In
Mm-hmm.
fact, you don't want to give a child some loads of sugar before they go to bed because we
Mm-hmm.
know what sugar does.
Yes.
So it's that really. And in terms of foods, I think that is what we want to watch out for. There is nothing really prescribed as something that could make things worse or less, but we all know that eating healthy is what we are looking for, irregardless of a condition of any sort, really.
Okay. All right. No, great.
Mm-hmm.
So now the question is, can someone actually be cured of this condition? So I know from when I was younger, they had a specific drug they prescribed, which would make the child dormant. They just lived in a state of limbo. So what is the management regimen or treatment regimen for someone who has ADHD?
Okay, so for the regimen, really, I'm always saying, there are people who are trained, to diagnose. And for this condition is our psychologist, our psychiatrist, and, they consider a lot of things when they are giving this diagnosis,
Mm-hmm.
things like the child's age, their medical history, the symptoms as they
Mm-hmm.
vary as well, the child's tolerance for specific medications, expectations for the course of the condition, and they also think about the opinion or preference for the parents.
Yeah.
And as with any other kind of medication, there always, some after effects, and the doctors will, talk to you about the side effects that you must anticipate. And
Mm-hmm.
this is where then you are sort of at liberty to say, okay, fine, maybe this is better than that. And then, that helps the doctor then, give a prescription for the child. But in terms of there being a cure, there is none. What is there is a management regimen.
Okay.
They are just trying to manage the situation. And so that's what the medication is for, really. And you find, I'm always, quick to say that, the medication, will deal with maybe the medical part of things, and there's always need for behavioral training to be coupled with the medication. So you'll find, yes, the child will take their medication, but we also need to train them, especially on behavior. You'll find that some children will not, they will not pay attention and are unable to finish tasks. So there are various therapies that are then there to help this child. For example, if they're the one who is slow to do tasks, you find that you want to be able to break down their tasks. They are not the child that you're going to give 10 things at the same time and say, I want you to do 1, 2, 3, 4, and 5. Because of their condition, we have to take that into mind when we are giving them the tasks to do, and maybe break them down, give them 2 tasks at a time, and when they are done with that, you're praising them, well done, now we're going to do the next 2. We are patient with them. So this is what also couples medication behavioral therapy.
Okay, no, that's pretty interesting. So I hear a lot of rewarding within that within that process, and kids do love that reward as well. So it makes a lot of sense. Now, you mentioned that there are certain things that can actually predispose younger children, like foundational issues, to presenting with ADHD when they are grown. So we do have adults who actually begin to have ADHD when they're grown. Is that
so they do not begin to have it. Mostly they would have had it from childhood, and they're probably those people that I'm talking about where it just went about unnoticed. And then they would find out as adult, and then would then call it adult ADHD. And you'll find that even their symptoms will be different, from a child. Those will present with maybe difficulties in paying attention. They can be also hyperactive and impulsive in behavior. A lot of them will have unstable relationships because, of the way that they just react and do things. A lot of them, if they are in school going age, their performance will be sort of poor in school. A lot of them have low self-esteem and other problems that are sort of adult related. So
So this will probably have to happen on another discussion. From what you're saying, their performance in school. So ADHD does affect someone's performance in school, which is what then probably people need to look out for, because you hear a lot of parents saying, "We are going to kuchkoro," but it's probably condition based, right?
Yes, definitely. And, the school is a place to pick it up quicker because there's a group of other children who are sort of exhibiting certain achievements that probably the one with ADHD will be failing to. Let's take, for example, a class of children in grade 6. They are already expected to do certain things. And you find this kid who is maybe not able to keep to pace with everybody. That is how it then becomes apparent. And we can then talk about, just the environment there at school where others are able to do times tables and maybe this child is not able to, and other children start to notice it as well. And kids will be kids. Yes.
They'll be teasing them, things like that.
They'll be teasing them, and it becomes uncomfortable for that child. And nothing is worse than that, because then they begin to feel out of place. The next thing, you are waking them up, they need to be going to school. They don't want to go to school because of those things that are happening at school. So school is really, really, a place where this can be noticed. And I'm glad to say there are also enabling environments in schools where these children can be put into facilities that are there made for these children. So it only takes the effort of the parent to also notice that my child has this condition, talk with the school, and they will place them in the place that they are supposed to be. And, things can be better for the child.
Which is awesome.
Mm-hmm.
So I think one of my last questions, are they high functioning? Are they high functioning children, like children with high functioning ADHD? Because, like with autism spectrum disorder, you've got people who have high functional autism and other things like that. But with ADHD, can we actually say that there are others who, yes, they exhibit the symptoms, but they're better than others? Like the intensity of the condition with the kids, does it differ?
It does. It
Okay.
does differ from child to child. And parents also need to know this because there's a tendency also to compare, and everyone is unique, Janet, irregardless of the condition that they have anyway. So the way you would do things is different from the way I'll do things, even if we have the same condition. So that applies to them as well. It differs from child to child.
This has been an amazing conversation, Charity. Thank you so much. I have certainly learned a lot. So
Thank
do you have any parting words for our listeners? Some reflections for families based on what you have seen as well in your practice.
Okay. I think for me, the word is support, really. These children just need your support, within the family, at school, everywhere, because they cannot do this alone. An environment has to be created where they feel safe, where they feel it's okay to fail and then, try again. So the word for me, Janet, is support, really.
This has been super awesome. Thank you so much, Charity.
You're welcome. It's been really good and a pleasure as well, just to be able to put this kind of work out there to the people, because at the end of the day, it's about knowledge, and it's about just getting the knowledge to the people. So I'm glad to have been here.
Yeah, definitely, because we don't hear too much, about ADHD. So it definitely is refreshing to know that, personally, when probably you're in church and you see that kid who's all over, or you're in the supermarket and you see the meltdowns and things like that, sometimes it's actually not their fault, and then the parents just asking yourself, why can't these parents control their children? And all those questions.
And that's the worst thing to say to a parent, really. That's the worst thing to say. They're trying their best.
Exactly.
And, those people also, we must take our hats off to them, because it's not easy.
No, it's not. Definitely not. So I'm so thankful and grateful to you. Thank you, Charity. We look forward to having you again on our show. And have a blessed day.
Thanks, Janet. Thank you.
All right. Goodbye.
Bye.